Good afternoon. Namaste. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, medical writer, and a budding YouTuber. So, on my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions every week on mental health, Ayurveda and psychotherapy, topics about mental health, Ayurveda, and psychotherapy, and related aspects. So, this week's discussion is on bipolar disorder. So, as you can see in my background, bipolar, the name itself says two, that is two extreme moods. Uh, one is the manic phase and one is the depressive phase. So, extreme mood fluctuations in the same individual. That is bipolar disorder. It is often confused with schizophrenia, but schizophrenia is different from bipolar disorder. So, without wasting time, let's get started. Let's know everything about bipolar disorder. I have named it as bipolar disorder simplified because it causes a lot of confusion. I've seen a lot of confusion around bipolar disorder. People asking me a lot of queries on bipolar disorder. So, let's get started. So, here bipolar disorder is, as I said, was also known earlier as manic depressive illness. So, that is a psychological disorder characterized by extreme and fluctuating shifts in the mood. So, once the person is very exhilarated and once the person is very depressed, so extreme fluctuations in the mood, energy, and activities. So, it typically involves two main phases, that is, manic episodes or manic. It was earlier named as manic depressive illness. So, the episodes were known as manic episodes. So, during the manic episodes, individuals experience elevated and expansive moods. That is, they have increased energy and decreased need for sleep and may engage in impulsive or risky behaviors. So, they often feel invincible and have racing thoughts. So, in the manic phase, in this phase or in during these episodes, individuals they have elevated mood usually, and they have increased energy, and they feel decreased need for sleep. They engage in impulsive or risky behaviors. And what happens is, next phase is depressive episodes or the depressive phase. The depressive episodes are marked by intense feelings of sadness, hopelessness, low energy, and a loss of interest or pleasure in activities. It will be like you will feel as if, is this the same person you saw in the manic phase? So the depressive phase is, marked by intense feelings of sadness, hopelessness, lower energy, and a loss of interest or pleasure in activities. So individuals may have trouble sleeping here also, experience, and they might experience changes in appetite, and even in the severe cases, they may have suicidal thoughts. So, this is the depressive disorder. One is manic episode, and one is depressive episodes. So, see, bipolar disorder is categorized into different types based on specific pattern and severity of mood episodes. So these types we'll discuss in the next session. So it can have a significant impact on a person's daily life and relationships. As I have said, every mental health disorder, the main impact in the person's daily routine, usual routine, and the professional routine, and the productivity and the relationships. The main impact in any of the mental health disorder is this. So as in any mental health disorder, here also we feel we face a person faces, impact on his daily life, his productivity, his daily life is hampered, and his relationships are, are also hampered. So here and in bipolar disorder, is a complex condition, usually influenced by a combination of, there may be genetic, it may be due to genetic combination, it may be due to neurobiological combination, or it may be due to environmental factors. See, while the exact cause of bipolar disease is not fully understood, there are certain triggers and factors that can contribute to the onset and or exacerbation or increase of mood episodes, in individuals with a predisposition to the disorder. So the exact cause why it is caused is not being fully, studied or fully known to us. But what is known is, it could be because of genetic combination, it could be because of neurobiological combination, or it could be because of the past history of any other mental illnesses, or it could be due to environmental factors. See, there are some triggers. So what are the triggers? See, what contributes, to increasing bipolar disorder, or what contributes to causing bipolar disorder in the first place? So stressful life events. See, significant life stressors such as relationship problems, financial difficulties, work related stress, or major life changes. For example, a person is getting divorced or loss of a loved one. These can trigger all the life stressors such as relationship problems, financial difficulties, work related stress, or major life changes, that is losing of a loved one, or shifting to an entirely new country or a new place, or having got a divorce or something like that. All these can trigger mood episodes in individuals with bipolar disorder. So it can increase the mood swings, the fluctuations, in if the person has bipolar disorder, or it can contribute in person, causing bipolar disorder as well. So the stress response can disrupt the delicate balance of mood regulation. So sleep disturbances. So disrupted sleep patterns, this because of the disrupted sleep, and because of the chronic insomnia is no sleep, difficulty in sleeping, or very less quantity sleep, or without, a person who cannot sleep, have a sound sleep. So um can lead to, so disrupted sleep patterns, either it could be insomnia, that is difficulty sleeping or no good quality sleep, or excessive sleep. Sometimes what happens when a person is excessively sleep, in on his bed, excessively engages in sleeping, that can also contribute to depressive mood fluctuations, so depressive episodes, so that can also trigger for mood episodes. So sleep disturbances affect the stability of mood in both bipolar disorders. So there are types in bipolar disorder. That types I will discuss in the next session. So substance abuse. See, the use of alcohol, tobacco, or recreational drugs, particularly stimulants like cocaine, etc., can trigger manic episodes. So manic episodes, or worsen depressive disorder, it can contribute to both. So substance abuse also is a trigger, and also can cause and also can trigger an episode of bipolar disorder. So substance and medication non compliance, so stopping or not taking prescribed any mood stabilization medications or any past medications for mental health disorder, as directed by the mental health professional or a healthcare provider, can increase the risk of mood episodes. So non compliance can lead to destabilization of mood and higher chance of relapse. So seasonal changes, so some individuals with bipolar disorder experience seasonal patterns in their mood episodes. So for example, they may have depressive episodes during the fall and winter, that is seasonal depression, and manic episodes during the spring or summer. So some individuals with um, the bipolar disorder, they have seasonal patterns. See, in during the winter and fall season they may experience more depression, and during summer or spring season they may experience more manic depression, so manic episodes. So hormonal changes, so hormonal fluctuations such as those associated with menstrual cycle or menopause in women can influence mood individuals with bipolar disorder. So substance withdrawal, so substance withdrawal also, like abruptly stopping the use of certain substances such as alcohol or benzodiazepines can lead to withdrawal symptoms that may trigger mood episodes. So and medical illnesses, so the substance withdrawal, I said substance abuse and substance withdrawal also. See, abruptly stopping the use of certain substances, if abruptly alcohol or some benzodiazepines are the drugs, like medicines prescribed. So that withdrawal symptoms also may trigger mood episodes. So and medical illnesses, see, people with physical health conditions or chronic illnesses can influence mood and potentially trigger mood episodes in individuals with bipolar disorder. If a person is having bipolar disorder and he has some physical chronic illnesses, so that may also influence sometimes in mood disorders. They can potentially trigger either manic episodes or either depressive episodes. So trauma or abuse, traumatic experiences including physical, emotional or sexual abuse can increase the risk of mood disorders including bipolar disorder. Then genetic factors, see, family history and genetics play a significant role in bipolar disorder. Having close relatives with the conditions can increase the likelihood of developing the disorder. See, as I said, family history and genetics, like having close relatives with the condition. If the person has close first degree relatives of people having his mother, his grandmother or father or grandfather, whoever, or uncles, second degree relatives having you know the disorder, bipolar disorder, or any mental health disorder in general, they have a likelihood of developing the disorder because they have increased chances of developing the disorder. So, um, see, everyone with bipolar disorder will experience mood episodes triggered by any one of these factors, and some individual more may be more resilient. They may bounce back. It might not affect them too much. It depends on the individuals as well, and for some people it might play impact significantly, and in some people it might not impact significantly. Both might happen. And additionally, while triggers can contribute to the onset or increase of bipolar episodes, they are not sole cause of the disorder. See, these can contribute in the increase. We cannot say that only these can cause, or only by these only a person gets triggered, the bipolar gets triggered, or bipolar is caused. So and see, I had mentioned the triggers for bipolar disorder. All these triggers, which we, saw, that stressful life events, sleep disturbances, substance abuse, non-medication, medication non-compliance, seasonal changes, hormonal changes, substance withdrawal, medical illnesses, trauma or abuse, and genetic factors. See here, we are talking completely on why it is caused. So that is that above we discussed maybe the cause or maybe the trigger to increase bipolar episodes, but here we are discussing, because it is a combination of, bipolar is a combination of genetic, neurological, and environmental factors. Now we are discussing the potential causes. Why is it caused? See, what are the genetic factors? See, there is a strong genetic component to bipolar disorder. It is seen that bipolar disorder is caused due to a strong genetic component. Matlab, that means people with a family history of the disorder are at a higher risk of developing it themselves. So several genes have been implicated in bipolar disorder, but it's likely that multiple genes interact in complex ways to increase susceptibility. So, and neurobiological factors, imbalances in neurotransmitters, such as, like, neurotransmitters are chemical messengers in the brain, present in the brain. So imbalances in the neurotransmitters, such as, what are neurotransmitters? They are serotonin, dopamine, norepinephrine. So the imbalances in the serotonin, dopamine, norepinephrine are associated with bipolar disorder. Changes in the structure and function of certain brain regions, like if there is a change in the structure and the function of certain regions in the brain, we have, in the prefrontal cortex or in the amygdala. These are all the parts or the structures in the brain, inside the brain. So there it has also been observed that the change in the structure and functions of certain regions of the brain have also observed in individuals with bipolar disorder. Then the environmental factors. See, environmental triggers or stresses can play a role in the onset and course of bipolar disorder. These can include significant life events, trauma, substance abuse, or disruptions in circadian rhythm. So, sleep wake cycles. Stressful situations can often precede mood episodes. So, environmental triggers here is, some life events, trauma, substance abuse, disruptions in the circadian rhythm. That means sleep wake cycle. Circadian rhythm is the sleep wake cycle. So disruptions in the sleep, late sleeping and waking up, all these things. So if there is no proper cycle, then, and stressful situations can often precede mood episodes. So, and biological factors. See, what are the biological factors? Hormone imbalances, particularly related to endocrine system, can influence mood and energy levels and may contribute to bipolar disorder in some cases. So hormonal changes, and which is particularly related to endocrine system and can influence mood and energy levels and contribute to the bipolar disorder in some cases. As for the global incidence of bipolar disorder, it is estimated to affect around 1 to 2% of the adult population worldwide. That means bipolar disorder, 1 to 2% of the adult population worldwide are affected with bipolar disorder. This prevalence may vary across different countries and regions, and it can be influenced by factors such as access to healthcare, cultural attitudes towards mental health, and diagnostic practices. So, bipolar disorder can occur at any age but often begins in late adolescence or early adulthood. So it affects both and men and women equally. So bipolar effect affects both men and women equally. People ask me, who does it affect much? So it affects both equally. It it is not, there is no gender discrimination there. So bipolar disorder involves a wide range of symptoms with manic and depressive episodes being the primary components. So what happens in the manic episode symptoms and what happens in the depressive episode symptoms? So in the manic episode, there is an elevated mood. That means individuals may feel extremely upbeat and elated, and often an exaggerated sense of confidence. In the manic episode, that individual may feel extremely elated. That means they're extremely happy and excited, and often with an exaggerated sense of confidence. They have very much. They are filled with confidence, self confidence. So, for example, they might believe they can accomplish anything, such as starting a successful business in a day. So, when they have elevated moods, they believe that they can accomplish anything. So, next, what they will have increased energy. So, manic episodes. Are often characterized by a surge in energy levels, leading to heightened activity. So, and restlessness. They will be overactive and they'll be restless. For instance, a person may clean their entire house in the middle of the night. So, this manic episode can happen any time of the day. It is not that it will happen in the day only, it will happen in the night only. If a person has a manic episode at night, a person may clean the entire house in the middle of the night, that disrupts his sleep, obviously. So, and reduced need for sleep during a manic episode, individuals might go without sleep for extended periods without feeling tired. They may stay up all night working on projects or engaging in various activities, and they will have racing thoughts. So what racing thoughts means, thoughts may race at an incredibly rapid pace. They will have continuous thoughts, making it difficult to focus on one task. They will have so many thoughts that they should do this, they should do that, or so many thought that it is difficult for them to focus on a task. So an example is like a person jumping between multiple unrelated topics in a single conversation. They will be in a conversation, suppose they will be thinking of different concepts in a single conversation of some other topic. And impulsivity. So impulsive behaviors are common here, such as reckless driving. If they are driving while a manic episode, and excessive spending sprees, like if they're shopping, they're buying items they don't need, or engaging in risky sexual activities or substance abuse or something like that, engaging in risky behaviors. So, and grandiosity. That means individuals may grandiose beliefs about their abilities or importance. They might, for instance, believe they possess some special powers, or that they are a famous figure. That means they imagine that they are something great, you know and they feel as if they have some special powers, or they are a famous figure, they are a celebrated figure or a celebrity or something like that. All these might happen in maniac episode. In depressive episode, profound sadness. There is profound sadness, that is feelings of extreme sadness and hopelessness are centered to depressive episodes. For example, a person may cry uncontrollably over minor setbacks. In If the same person who was in the manic episode, he will be in the depressive episode, he will feel profound sadness, and he may cry. Uncontrollable crying may happen, for example. And loss of interest, a lack of interest or pleasure in activities that were once enjoyed, such as hobbies or socializing. They will have a lack of interest in pleasure. For instance, what happened, someone may stop attending social gatherings they previously loved. They avoid social gatherings, or they avoid public events, something of that sort might happen. And fatigue is profound fatigue is feeling tired, constant feeling of tiredness. So profound fatigue and low energy levels are common during depressive episodes, making even simple tasks like getting out of a bed a significant challenge for them. Just to get out from the bed, getting out or getting up from the bed is a significant challenge because they constantly feel tired. So, and then changes in the appetite and weight. There may be significant changes in the appetite leading to overeating or undereating. Both might happen. Person in depression, in depressive mood, he or she might eat, overeat or undereat or binge eating. So this may result in either weight gain or weight loss. Both might happen. That would be noticeable. So changes in the appetite and weight. So, and sleep disturbances. See, insomnia, there was sleep disturbances. The person in the manic episode was not able to sleep because of the excessive energy. Here there will be excessive sleep, ulta, hypersomnia can be present. A person might find it difficult to get up. So he excessively sleeps during the day or during the depressive phase. Negative thoughts, so persistent negative thoughts, self criticism and feelings of worthlessness are typical. For example, a person might believe they are a burden to others, or their life is utterly meaningless or devoid of meaning. So they will have persistent negative thoughts, they will self criticize, and the confidence is very low here. So, and feeling of worthlessness is, a typical feeling is feeling of worthlessness, that is, I am not worthy of anything. And next, in very severe cases, there will be suicidal thoughts. In severe cases, individuals may experience thoughts of self harm or suicide. These thoughts should be taken very seriously and immediate help should be sought. See, all this, well, while I talk about all these symptoms, all the symptoms may not occur in all the individuals. So different individuals will experience different symptoms, different kind of manic episodes and different a kind of depressive episodes. These are the general symptoms. It may be that a person experiencing bipolar disease might not experience all the symptoms together, but these are the general symptoms. See, as I said, no everyone not everyone with bipolar disorder would experience all these symptoms, and their severity can vary from person to person. See, additionally, individuals with bipolar disorder often have periods of stability between the mood disorders. It might be like a person can experience manic episode in the morning, and in the afternoon he's fully stable, and then in at the night he might experience depressive episode. It might be vice versa. So, if you know someone who is experiencing the symptoms like this, so seeking a mental health help, or seeking help from a psychotherapist or a psychiatrist is very much essential here. So, and now we are going to know what are the impact. The last discussion for the day is what is the impact of bipolar disorder on the mind and body. How does this affect the mind, and how does these affect the body? So impact on the mind, mood swings. So mainly mood swings. Bipolar disorder is characterized by extreme mood swings between manic and depressive disorder. During manic episodes, individual may experience elevated moods, racing thoughts, and high energy. Depressive episodes involves feelings of sadness, hopelessness, and low energy. These mood swings can disrupt daily life and relationships. So, next is cognitive function. So, bipolar disorder can affect cognitive functioning. Cognition here is thinking, memory, concentration, all these. Okay, leading to difficulties in concentration, leading to difficulties in memory, leading to difficulty in decision making, particularly during manic and depressive episodes. So cognitive impairments, that is thought process impairments can impact work or academic performance. And impulsivity, during manic episodes individuals may engage in impulsive and risky behaviors, as I said, such as excessive spending, reckless driving, or substance abuse. So what will happen, these will have negative consequences on personal and financial well-being, and physical well-being as well, and mental well-being as well, all the four aspects, you know, personal, financial, physical, and mental well-being. So, and psychosis in severe cases, this is not in any typical case, this is in severe cases, especially during the manic episodes, individuals with bipolar disorder may experience psychosis, including hallucinations and delusions, which can distort their perception of reality. So hallucination is the feeling, the things which are unrealistic things, so they are called hallucinations, and delusions, confusions, so which are not real. And impact on relationships, mood swings and behavioral changes can strain relationships with family, friends, and colleagues. So mood swings and behavioral changes, what will happen, it will impact the family relationships, that is with the family, with the friends and the colleagues. So maintaining stable relationships can be challenging for individuals with bipolar disorder. Next is, these are the impact on the mind. What is the impact on the body, especially sleep disturbances. So as I said, in both manic episode and depressive episodes there are disrupt sleep patterns. And then is appetite changes in the appetite. That is in manic episodes there may be need for reduced, they may reduce the need for food, while in the depressive episodes it may lead to overeating or binge eating, or even under eating or no eating, potentially resulting in weight gain or weight loss. Both might happen. And physical health is stress associated with a bipolar disorder can have physical health implications, potentially increasing the risk of heart diseases, diabetes, and stress related disorders. It is also impacting the physical health. And medication side effects, like medications used to manage bipolar disorder, such as mood stabilizers, antipsychotics are given sometimes. They can have side effects that impact the body, including the weight gain, metabolic changes, and potential long term effects on the liver and kidneys. That is the reason I don't prefer using medications which have long term side effects to them. That's why we my focus is to manage or treat the condition with the psychotherapy, and which is the non pharmacological approach only, and only 5% of the ayurvedic medications whenever it is needed. And self care challenges here. So the ultimate challenge is self care challenges, that is individuals with bipolar disorder may struggle with self care during depressive disorders. They might not exercise, they might not eat healthily, they might not work productively. So that what happens is they neglect personal hygiene as well sometimes, and there is a poor nutrition and lack of exercise. So, and see, while we talk of everything, with appropriate treatment, that is with psychotherapy and other therapies and management, bipolar disorder, people with bipolar disorder can lead fulfilling lives. You know, so lifestyle modification, diet modification, psychotherapy, and support groups, etc. All these, combined, I will discuss the treatment of bipolar disorder in the next session. And in the next session we are also going to discuss not only the treatment, but the types of bipolar disorder, and the treatment aspect of it, what all psychotherapies can be done, and what does ayurveda has to say about it. All these will be discussed in the coming sessions. So Thank you for staying tuned for the session. If you have any doubts, or if you have any thoughts or views or opinions on the subjects which I talk, please do share in the comment section. And if you want me to discuss some other topic, let me know in the comments section as well. So thanks for watching, and namaste for today.